Welcome to this instructional video on transferring a patient with a highly infectious disease from routine care to an infectious disease isolation facility. In this video, we will guide you through the step-by-step process to ensure the safety of the patient, healthcare workers, and the public. Please remember that this process requires specialized training and should only be done by trained healthcare professionals. Let's get started.
Uganda is an epidemic-prone country. We lie within the region, and between 2000 and now we have registered 10 viral hemorrhagic and severe acute respiratory disease outbreaks. The transfer of these patients requires careful planning, coordination, and adherence to protocols in order to minimize infections to the community and also to the healthcare workers.
Preparation. Before initiating the transfer, it's crucial to gather all necessary supplies and ensure the receiving facility is ready to receive the patient. Follow these steps to prepare. Step 1. Assemble a team of healthcare professionals who have received proper training in infection control protocols and the transfer process. Step 2. Communicate with the infectious disease isolation facility to confirm their readiness to receive the patient. Provide them with all relevant information about the patient's condition.
Hello?
Step 3. Ensure that the necessary personal protective equipment is available for all members of the transfer team. This includes gloves, gowns, masks, and eye protection. Step 4. Prepare a designated vehicle for transfer that is equipped with the necessary medical supplies, including appropriate waste disposal containers. If this is during an active public health emergency, ensure the ambulance to be used is decontaminated. Preparing the patient. The referring team performs a formal handover to the ambulance team, providing the case investigation form and patient medical records. These items should be obtained from the office and kept in a clear plastic bag in the driver's compartment of the ambulance. Now let's move on to preparing the patient for transfer. Dress in appropriate personal protective equipment before entering the patient's room. Refer to the donning and doffing of personal protective equipment video resource. Greet and introduce yourself to the patient. Follow strict infection prevention protocols, including proper hand washing or the use of alcohol-based hand sanitizers and spatial awareness. Refer to the hand hygiene video resources. Conduct a thorough assessment of the patient's condition, including a complete set of vital signs, and offer any emergency interventions before setting off. If intravenous access is required, have this done before setting off. Communication is made to the call center, notifying the current clinical status of the patient, and a decision whether the patient is eligible for transfer is made. Explain the transfer process to the patient and address any concerns that they may have. Please note that the referring team should have discussed the referral and obtained consent prior to contacting emergency medical services. However, consent is an ongoing process that should be obtained throughout the transfer activity. Ensure that the patient is wearing a surgical mask to minimize risk of spreading infectious droplets during the transfer. Carefully disconnect any medical equipment or devices from the patient, ensuring they are safely secured or covered to prevent contamination. Place any necessary intravenous lines or monitoring device on the patient to maintain their stability during the transfer. Transfer process. It's time to initiate the transfer process. Managing wet patients. For patients who may have infectious body fluids, take additional precautions. The medical team should follow proper body mechanics and lifting techniques to prevent injuries during the transfer. Consider wrapping the patient in a waterproof sheet to contain and prevent the spread of any infectious fluids. The waterproof sheet will help maintain a barrier and minimize the risk of contamination during the transfer process. Loading the patient in the ambulance. Ambulant patients should be directed to walk to the vehicle. Patients needing support should be carefully transferred onto the ambulance stretcher or bed, ensuring their safety and comfort. Waste management and disinfection. As the patient is being loaded into the ambulance, the medical team should manage any waste generated during the transfer process. Dispose of any used personal protective equipment, packaging materials or other waste items according to established protocols. Disinfect the door of the patient chamber in the ambulance using a suitable disinfectant solution to minimize the risk of contamination. Close and secure the doors of the patient chamber before the ambulance sets off to the treatment unit. In the ambulance, double-check that all necessary medical equipment and supplies are securely fastened to the transfer stretcher or bed, including oxygen tanks or other life support devices. Once the patient is safely secured, cover them with a clean sheet or blanket to provide comfort and maintain their privacy during the transfer. Finally, let's proceed with the transfer to the infectious disease isolation facility. Unless otherwise stipulated in the prevailing guidelines, the health worker should accompany the patient in the patient compartment of the ambulance, providing care during transportation to the isolation facility. Follow designated routes and protocols for transportation, avoiding crowded areas and minimizing the risk of exposure to the general public. Upon arriving at the isolation facility, coordinate with the facility staff to ensure a smooth handover of the patient. Provide them with all relevant information about the patient's condition, ongoing treatments, and any special requirements. Hand over a clean copy of the patient's records in a clear plastic bag. In addition to the patient records handed over in the green zone, the ambulance team should provide a verbal handover to the receiving team, summarizing patient demographics, disease condition, vital observations, and treatment given. Once the patient is safely transferred to the isolation facility, carefully remove and dispose of your personal protective equipment according to established protocols. Ensure proper hand hygiene is maintained. The ambulance should now be taken for decontamination and cleaning prior to use for another patient transfer. Refer to the ambulance decontamination video resource. Remember, throughout the entire transfer process, strict adherence to the infection control protocols, proper hand hygiene, and the use of personal protective equipment are essential to minimize the risk of transmission, ensuring the safety of both the patient and the healthcare team. Thanks for watching.